Now we have 5 speakers, young, bright, and active generation from Thailand, Bangladesh, the Philippines, Vietnam, and Myanmar. Some are students, some are young adult, and some are in health area, and some are not. So this is a good combination of speaker. I would like to repeat again that the speaker will present their work in 10 minutes each. And then we will open the floor for discussion. And if you have a question, please text us on a chat box. Give your name and your country too. Shall we start with Miss Suphaphit Chaiyadit, President of Children and Youth Council of Thailand. She just graduated from Thammasat University and extremely busy with collecting voices of youth beyond COVID-19. And last year, she got a Thailand National Outstanding Youth Award 2019. I will call her shortly Jane. Jane, could you brief us about your organization and what you have done during COVID-19? Thank you.
My name is Suphaphit Chaiyadit. I'm a President Children and Youth Council of Thailand. Okay. Before we start, please let me introduce my organization. The Children and Youth Council of Thailand, or CYCT, is the largest youth network in Thailand, formed by law in 2007. Now Thailand has 8,780 CYC in all levels with 2,100 members. CYC has a key role in representing young people to raise their voice to policymakers. Okay, this survey was led by CYCT and UNICEF with the supported by UNDP and UNFPA. The survey conducted online and distributed through network of CYC, sub-district and partner network of UN agency and got response from 6,771 young people from across Thailand. The key objectives of this survey are to understand and situation, knowledge, need, and impact of COVID-19 among young people's lives. The survey has a total 26 questions, includes choice and open-end questions. Okay, next. Okay, let's see who answered this survey. Of the 6,771 respondents, most of them are female. Male respondents are around 27%, and we have autistic or LGBTIQ around 2%. Yes. 57 aged between 15 to 19 years old, and they are studying in high school and university. Key finding. Let's move to see what we found in this survey. Okay. The respondents expressed 2 levels of concern that they felt for the impact. First, far-reaching impact on children and young people, and second, personal impact. Major concerns of children and young people are economic impact on both their family and the society. The second one is the mental health, such as stress, boredom, lack of motivation. The third one is a disrupt to normal education. The fourth is employment opportunity. The fifth is using too much of internet that leads to inappropriate browsing. Yes. Okay. For LGBTIQ group, we also find that their key concerns are more high than other sex in mental health issues, which includes loneliness due to lack of interaction with family members and more state from being quarantined. And the last one, they have increased pressure on gender-related issue because of the family situation. We assume that some of them may not have disclosed their gender identity yet. Okay, next. The children are at risk of burnout and need for self-care from all aspects. Loss of financial status, stress, and lack of motivation, educational problem, employment opportunity, and risk to be infected with the virus. Youth young people express their needs to have access to financial support from the government, such as financial relief package or financial support to pay their future fusion fee. Okay, mental health is a high requirement due to the COVID outbreak, as many young people expand on their safety and livelihoods that affects during the lockdown period. Policy should also address their concern and empower them to find options to take free and quality online learning on first online business, second entrepreneurship, and third financial management. The rapid survey is a powerful communication tool for children and young people to be able to express their concern and stress. As the majority of respondents have a strong knowledge to how to protect themselves for coronavirus, they could be to potential advocates to disseminate the knowledge to their households on how to protect themselves from the pandemic. The government and school need to communicate clearly to students. Government needs to ensure that children in education are communicate to reduce stress. All schools should communicate and reach out to the student thoughts communication line to suggest on how schools are preparing to help children. Okay, thank you.
Thank you very much, Jane. And I'm sorry that at the beginning the PowerPoint didn't show up, but I briefly explained that Children and Youth Council of Thailand is the first organization that do a rapid survey of the impact from COVID towards youth and children. So that and she come up with many interesting concerns from youth and also conclusion that she mentioned that you can see it from the PowerPoint. Uh, let's move to another, the next speaker, because we have 5 speakers in total. So I don't want to interrupt the speaker. The next speaker, Mr. Asadur Rahman Nabin, sorry from my pronunciation. He is the National Officer of Human Rights and Peace from Bangladesh Medical Students Society. I will call him shortly Nabin. Nabin is a medical student at Bangladesh Medical College. Apart from working at Bangladesh Medical Student Society, he is also a campus coordinator for COVID Volunteers Bangladesh. Nabin, please tell us about your organization and what you have done during COVID-19.
Thank you, Nanook, for giving me the floor. Can I see the presentation?
Yes,
Yes, thank you.
it worked good.
Yes, it's visible right now. Hello, everyone. I'm Asadur Rahman Nabin, National Officer on Human Rights and Peace, BMSS Bangladesh. So today I'll be talking about BMSS, my organization, and what we have done during this COVID-19 pandemic. So the next slide, please. Thank you. So at first, I would like to tell something about my organization, BMSS. Bangladesh Medical Student Society was established with the aim to make a better, safer future for our nation through medical students, fulfilling our needs and member of the health as a member of health system. Is Bangladesh Medical Student Society is dedicated to the improvement of healthcare delivery systems, as well as medical education, so that the healthcare may become more personal and holistic in a world of increasing technology and efficiency. We believe that healthcare should be oriented towards the achievement of health and not solely a treatment of disease. Next slide, please. So from now, I will be talking about what we have done during this pandemic to build a multi-sectoral collaboration of different sectors to fight COVID-19. So the number one event or activity that we had undergone was the COVID-19 catastrophe in the refugees. So SCORP, Standing Committee on Human Rights and Peace from BMSS Bangladesh, organized a COVID-19 catastrophe in the refugees from 30th May to 12 June, talking about the refugees in Bangladesh, Rohingya refugees, violation of their rights, and what can be done to promote their lives. On 12 June at 8 p.m., a webinar was conducted on the same topic. The guest speaker was from a local NGO called Jago Nari Unnayan Sangstha, who directly worked with the Rohingya refugees in the camps. The aim was to make the medical students more empathetic towards the refugees. The medical students who were willing to work for refugees got a clear idea on how to execute their plans. With the active participation of almost 5,000 medical students, the event became very successful. Next slide, please. Next, we had two other events. One was on access to healthcare during this COVID-19 pandemic, where our organization arranged another webinar on access to healthcare during this pandemic. Three renowned external partners from Bangladesh, Saudi Arabia were present. They discussed the burning issues, shared their personal experience, and also their solutions. We also talked about, we had a collaboration with the King Saud Hospital Diabetic Center and International Medicine Fever Clinic, and also Save the Children Bangladesh. And next onwards, we had a program where we taught the medical students about the current surgical protocols that needs to be maintained during this COVID-19 pandemic. During this pandemic, the frontliners were lacking the proper guidance for surgical procedures, and for this, our purpose was to enlighten them with proper guidance so that they can save themselves and save us. Our speaker was from Dhaka Medical College Surgery Department, the most renowned government medical college in Bangladesh. Next slide, please. The next two events that I'll be talking about is next slide, please. Yes, thank you. So the next two events I'll be talking about are, number one, let's call it what it really is. This was actually based on domestic violence. We all know that domestic violence is the violence in a home setting. Domestic violence is on the rise during this pandemic. So to address this, BMS has organized a 10-day campaign and a webinar where we invited two special guests. One, the executive director of Manusher Jonno Foundation and a mental health advocate. Medical students, or us youths, got to know what their role was to tackle such conditions and how to advocate women in that regard. And lastly, we had another webinar on health challenges during the quarantine. We all know that during this COVID-19 pandemic, the geriatric people and the people who are suffering from chronic diseases are actually suffering a lot more because they can't actually go to healthcare services very often and commonly right now. So keeping all these in mind, a webinar was conducted where medical students were advocated on how to deal with these patients. And on this situation, we actually had a medical officer from Study Deputation OSD and DGHS, that is Director General of Health Services, the government organization from our country. And he's also and another person who was the resident of internal medicine from Mymensingh Medical College. So from all these webinars and from all these activities, we actually could come forward with multi-sectoral collaboration and the need for these collaborations among different sectors, like it was surgical sector, then for the refugees, for domestic violence, health challenges. From all this together, we actually could find out that we need multi-sectoral collaboration for fighting COVID-19. That's all for me. Thank you.
Thank you very much. You are very active, and it seems like you have many fan club from Bangladesh audiences. I would like to go to the next speaker. The next speaker will be from Philippines, Miss Rena Mallillin, President of ASEAN Medical Students Association Philippines, and also Head of Communication for Public Health Council. She is studying Medicine and Business Administration at Antino School of Medicine and Public Health. Her brain can twist from medicine to business and vice versa quickly. And Rena, could you brief us about your organization and your activities during COVID-19?
Hi, okay. There is the Can you flash the presentation, please? Hi, good afternoon, everyone, or good evening. On behalf of AMSA Philippines, I would like to thank National Health Commission Office of Thailand for inviting us here today to discuss and highlight the role of the youth on the response of against COVID-19. I'm Rena Mallillin from AMSA Philippines, and I'm here to discuss our organization's response to COVID. Next slide, please. So, Asian Medicals, back one slide. Asian Medical Students Association Philippines, or AMSA Philippines, is a network of different organizations from various medical schools in the Philippines that seek to serve as a platform for advocacy among medical students, pushing for better healthcare and social justice in the country. We aim to provide avenues for Filipino medical students in pursuit to become holistic advocates and relevant physicians of the future. We are national member organizations of AMSA International and International Federation of Medical Students Associations. Next slide. Knowledge, action, and friendship has always been our defining core. So even before COVID-19, we are already doing advocacy campaigns and statements to increase awareness on pressing health and social issues, community programs such as medical missions in hopes to change the upstream of healthcare system, and of course, we go beyond geographical borders, not only to bring back knowledge, but also lifelong connections. Next slide. Our organization has two major responses to COVID-19. The first one is Likha COVID-19 online campaign on March 15, 2020. The Philippine government placed the country under quarantine. Its policies then remained unclear, and Filipinos, including medical students, remained insufficiently informed. With the demand for more information came the increased use of social media and consequently the increased spread of misinformation. In addition, the majority of accessible materials on the pandemic are in English, while the Philippines has numerous native languages. The project aimed to provide context for the general population and medical students on the pandemic. We were able to translate infographics to 6 of the major languages in the country. Our target audiences were the uninformed population who does not know much of the disease. We provided them with information on prevention and initial responses of the country to COVID. Then there's the informed general population. We expanded their knowledge on the multi-sectoral implications of the pandemic, including human rights concerns, gender-based violence, mental health, environment, and other social determinants of health. Lastly, we cater to the medical students by sharing mental health tips to cope with the current lockdown. We also expanded the project through partnership with the Philippine Medical Students COVID-19 portal, which provided medical students an avenue to develop a curriculum on COVID-19, providing public health perspectives and information on pandemic response. This expansion helped us in our goal to combat misinformation, expanding knowledge, and providing context to the Filipino people. Next slide. The Philippines is one of the countries who sorry. Um, the Philippines is one of the countries who suffered the most from COVID-19. We had the longest and probably the strictest lockdown in the world, about 5 months and still running. There has been a devastating shift to the online platform, which caused our organization to switch as well. Exchanges and conferences that are done every year are being done virtually. Advocacy campaigns were amplified online, and our medical missions shifted to telemedicine. The Philippines Department of Health launched the COVID hotline at the height of the pandemic around April. It was when the hospitals were filling up and there weren't many doctors available for the program. AMSA Philippines became volunteers for the program, which provided an opportunity for medical students to serve and train through telemedicine. We noticed a few language and geographical barriers as well, which initiated an expansion to other regions of the country. Besides the two, we had a webinar series in partnership with Asian Medical Doctors Association about COVID-19 that covered topics from return to the workplace, COVID-19 survivors, vaccination, and the likes. Earlier this month, we had our annual conference, which was, of course, shifted online. Um, that focused on other social determinants of health, such as politics, the law, the environment, mental health, and others. Next slide. With the transition to the new executive board, we plan to continue our efforts for COVID-19 response. We currently have plans for a mental health campaign where we will empower the youth by giving psychological first aid workshops to undergraduate and medical students, coupled with an awareness campaign that will be guided by a qualitative data gathered through focus group discussions. As we shift to online learning, our right to education is also at risk due to the inaccessibility of the internet, especially in rural areas. Hence the creation of pocket Wi-Fi donation drive for medical students. Moreover, we plan to focus on neglected health issues in the pandemic, such as a disaster risk reduction and non-communicable disease. And lastly, we will have a relief operation for the indigenous people of the Philippines that are neglected even before the pandemic, and now in the time of COVID, their situation has worsened. Next slide. Aside from the previously mentioned collaboration, the new term also established new partnerships. We first partnered with the Human Spirit Project. It's actually containing stories from the Philippine General Hospital, which is one of the designated COVID centers in the country. We partnered with them because their content was an important reminder that in the midst of the pandemic are people. It shows us the humanity that runs through the veins of every Filipino in this fight against COVID-19. Next is Bagong Gawi, which aims to help Filipino adjust to the so-called new normal by releasing infographics in different Filipino languages, just as we did with our initial campaign. The content of their infographics discusses the different lifestyle changes impacted by the measures to control the spread of the virus. We also partnered with the Project Insight for their webinar on COVID-19 vaccines, which aim to explore the complexities and deeper details of developing a vaccine for the virus. It came at a very crucial time when one of the vaccines on clinical trial was fast-tracked. Two of our latest partnerships we have are the Healthy Philippine Alliance, or HPA, and with Social Innovation in Health, or CHI. The partnership with HPA aims to explore the impacts of COVID-19 on people living with non-communicable disease, or NCDs. As one of their consulting members, we take part in organizing their project. The goal is to raise awareness on people living with NCDs and of ultimately engaging our government to integrate policies on NCDs to the response in the pandemic. Meanwhile, the partnership with CHI seeks to explore the role of the youth in finding innovative solutions to concurrent problems posed by the pandemic. This project we have is in partnership with WHO WPRO, and we aim for these solutions to be presented at a local and regional level. In these trying times, it is important that we empower the youth to continue exploring social innovations of their own. Thank you.
Thank you very much. The first three speakers are student generation, in the sense that everything that you mentioned is online, pocket, Wi-Fi donation, telemedicine, and everything. But next, which is the next speaker, we have two more speakers in the queue. Next person is Mr. Lee Kwon Dang, a founder and coordinator of Mekong Youth Network from Vietnam. Very interesting. I will call him Dang in short. Dang. Dang has an interesting lifestyle because he is a farmer as well as a researcher. He works at Canton University in Vietnam, and right now he's doing PhD in Chiang Mai University, Thailand. Dang, tell me about your network and what a farmer like you has done during COVID-19.
Where is the slide? Okay. Good afternoon, everyone. So my name is Dang. I'm actually live in Cần City, where is center of the Mekong Delta right now. And first of all, I would like to thank to NHCO, you give me the opportunity to share our work, and also thank to our friends from 5 countries of Mekong, because we work together on this one, and very nice that I can bring the the result of the project. Actually, now we are writing the report and send to and submit very soon. Um, so so next slide, please. Next slide. Okay, maybe some of you don't know about Mekong region. I just very briefly about this. That's what and why we work for the Mekong uh, and why we work for the Mekong region. So the Mekong River is around 5,400 kilometers. We start from Tibet of China and end in the Mekong Delta, like in my hometown Sopchang province. And so Mekong White Farm Network is developed by from Mekong youth in 5 countries in the region, and we focus on farming education, teaching farm, youth engagement, and until now we have targeted more than 1,000 youth in 5 Mekong countries. And we organize training courses on sustainable farming, and we organize a field trip, and also we started the seed saving, like the seed bank. And our mission, maybe I just briefly very fast about this. And White Farm is initiative for we not only work on the food security, but also we try to resilient the Mekong community, which focus on the relevant issue that I just mentioned about above. Next slide, please. So before the COVID-19, actually we are working on the seed saving bank and food security and farming education, blah blah blah. And during the COVID-19, we talked, we discussed together, oh my God, how we can how we can help the people to roll our own food, because as you know, the main policy for every country is stay home, and many people, they cannot work in the factories, in the companies, or at the labor, or cannot or they even couldn't selling anything in the market, blah blah blah. And that's why, okay, maybe because based on our work, we have some knowledge about how to roll the food at home, and also our network member, we also set the seed, especially the local seed. And so that's why we commit to work together on this. And 3 main activities that we implement in 5 countries is, first, we develop the guidelines, okay, if you stay at home, how you grow your own food, especially for the poor people in urban communities. Why the poor? Why urban poor? Why urban resident? Why urban people? Because when they have small land and no land to do anything. So that's why if the urban people join our activity, it means okay, they really need us. And the second one, actually for the first one, the guideline, we work with the partner in another urban farm in Bangkok, because Miss Fai, she's she worked on this issue for many years, and she have experience about this. And the second one, we before giving the seed, also the guideline, also the fertilizer to the local people, how we try to investigate them. I mean, how they need, they need the seed, or they need something like the guideline, and blah blah blah. And after that, we count the amount, how many people and what kind of seed do they need, and then we distribute the seed for the beneficiary. And the third one, so we not only develop the guideline, we not only investigate the local people needs, and also distribute the seed to the target people, but also we work with our white farm member in Thailand and also in Cambodia to write some story, how to inspire them, please, for example, the story telling about, if you stay at home, why don't we roll our own food, and then try blah blah blah, something like that. So I will share you very next slide, please. Like this, the guideline, we work with around urban farm in Bangkok. So she developed very nice the guideline, for example, how step by step about roll the food at home, and also how to make the compost by your weight, the food weight, something like that, organic weight, and then how to produce the bio fermented juice to take care. For example, in this way, you can use the food waste, organic waste, to reduce the fertilizer, and also blah blah, and then produce the bio fermented. In this way, you don't need anything from buying anything like chemical to take care your vegetable. And after developing the guideline in English, we work with the youth, our member, country representative in each country, to translate this guideline in the local languages, because we work with the local people and they cannot read English. That's why we, next slide please. And for the I already tell you, before giving the seed, we do the investigation, and after that we distribute the local seed for the local people. So you can see in this country we work in different way because we are different. Yeah, each country have different process. So in Laos, the Than Phun organic farm work by themselves, and with some volunteer, and they go to the community around Vientiane capital and Vientiane city to distribute the seed to the urban resident in Vietnam. So we based in Cần Thơ city, but we would like to work, or we would like to distribute the seed and the guideline, also fertilizer, to everyone in across Vietnam. So for example, in the northeast, Hanoi, and Ho Chi Minh City, Cần Thơ city, and also some city around Ho Chi Minh City. So not just only one city. But in Thailand, it's very interesting, the guy from our partner from Chuk Chai Organic Farm in Lamphun, he would like to work with the community in Lamphun city only, and he tried to organize the not just only give the seed or explain how to grow the vegetable, but also he trained the local people, I mean, bring the methods, some equipment, the tool from his farm to the meeting, and try to invite the academic person from Metro University in Chiang Mai to come and share, blah, 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 and how important to grow the food at home, something like that. And in Cambodia, the same way in Vietnam, we also distribute the seed to everyone across in the country. But Myanmar, the same with Lao and Thai. They just work with the people in one city. Next slide, please. So like a continue for investigation and distribute the seed. Actually, you know, the policy stay at home and like social distance. So we cannot travel a lot. And also that's why, you know, but if we are in the one city, I mean, if we stay in that city and we would like to go to the local people house, local people family, or some I mean some people who have a garden to talk, to discuss with them directly about the guidelines about how to grow the food and also take care our vegetable at home, something like that. So that as I told you, different people have different perspective. So for example, you see the picture from Cambodia, you know, they just send the seed by mailing, something like that. Next slide, please. And for the third activity, like I told you, we not only like develop the guideline, how to take care, how to produce the fermented juice, to take care of the vegetable, to take care of the crop, distribute the local seed, but also we write a story like inspiration story and seed, and try to develop the seed bank network. Actually, we already exist the seed bank network, the seed bank in Thai. It's in Eastern region of in the northern of Thai actually. But you know, during working with the beneficiary in each country and in the community, actually from the investigation process, we ask them like because the seed that we give them are the local one, the traditional one. So the like after the beneficiary role, they can keep the seed for themselves for the next cultivation. So actually, when we give them the seed, we also tell them about this, and that may be like, okay, like please keep the seed, and then maybe use the seed for the next cultivation, or maybe send it, give it to your friends, to your colleagues, to your neighbor, and then you know, in this way. So we have the list of beneficiaries in each country, like 60 people, 60 family in each country, and like you know, and you know now, like okay, in 5 countries we target like around 300 families. So in 300 families, they commit to sell the seed and to distribute this kind of seed, also the guideline to other people in the community and in the country. So we work with some friends in Thailand, in Vietnam, to develop the story about okay how important when you roll the food, when you roll own food at home, and blah blah blah, something that you can see as a picture. Something. Okay, the next slide. Okay, project partner, like very interesting. Okay, in each country we work different, you know. Okay, for example, in Myanmar, they should work for themselves with some youth volunteer in Chiang State, in Thongchi City, to distribute the seed and meet the local people in the city, or in the rural community. And in Laos also the same, work themselves with the volunteer. But in Thai, you know, they work with 5 partners. Sukchai Organic Farm representative in Thai to work to implement this kind of project, and they work with 5 different partners in like a metro university, some the organic seed company also. So try to work with different partners to implement this kind of activity. And in Thai, we also work with the Ranpa Urban Farm in Bangkok and Mekong Farm in Ubon Ratchathani. But in Cambodia, they work for themselves actually with the local volunteer youth, and in Vietnam, okay, like Wild Farm work with Mekong nursery of local species, and also we work with HEPA eco farming school in Happen, because this organization actually recommended us to give the seed to one community in the highland of Vietnam, because they really need they have something. Next slide. Okay, like thank you, and maybe I can explain more later if you have any question.
Thank you. When I heard your story, I'm thinking of a proverb like gives a man a fish, you feed him for a day. But if you teach a man to fish, you feed him for a lifetime. This is
right.
That's very good. Now we come to the last speaker, Dr. Myitzu Kwan. Again, sorry for my pronunciation. I will call you Myitzu. Myitzu is a program manager at Community Partners International from Myanmar, working with ethnic groups. But at the same time, she is working with youth as a member of U.S. Ambassador Youth Council. Myitzu, could you tell us your organization and your activities during COVID-19?
Thanks, Nanot, for introducing me, and thank you all the speakers that talked before me. They are really interesting, and it's really knowledgeable for me. And thanks NHCO for organizing this webinar, and thank you all the participants for your time being here. So good afternoon, everyone. As Nanot said, my name is Myitzu, and I'm from Myanmar. You can call me Myitzu, and my background is public health, but now I'm working as a program manager for organization development at international NGO called Community Partners International. So it's very nice to be here, first of all. And then I would like to admit one thing, that even though I do a lot of presentations and facilitations, I'm really excited for this presentation, because we are seeing a lot of exciting projects and youth population here. So I'm so happy to be here, first of all. And I would like to say that my presentation would be quite different from the others' perspective, because I would like to highlight why the youth activities are important from the public health point of view in system review settings. So it's more like a general overview, and why we are asking for more youth involvement in our public health activities, and how do we see the challenges working here in Myanmar, especially in ethnic organizations. So we won't highlight a lot in the activities that we are doing by the Community Partners International, because one is our executive director already had a webinar on the with the NHCO, and our activities are updated in our website time by time. So if you are interested in more activity-based, I would suggest to visit to www.cbiinternational.org as here. So like I said, I'd like to approach my presentation in more systematic way and systematic review. So can you please go to the next slide, please? So I'd like to start with the update of the COVID-19 here in Myanmar, how it is hitting here, and what the impacts of COVID-19, especially in Myanmar setting and in some of the resource scarce areas. And for the agenda number 3, I have what youths are implementing in Myanmar. And another 4 is that what are the challenges for the youth activities to get systematized and mainstreamed for the activities in the prevention and control of this pandemic. So this is the updated COVID-19 information for Myanmar. As you can see, we do not have thousands and thousands of cases detected here in Myanmar yet. Fortunately, however, we are seeing the second wave of COVID-19 coming since the last week, and we are trying to sort of get more testing and more prevention measures in regards of this. So next slide, please. Hello. Hi. Next slide, please. Thank you. And then one interesting thing here in Myanmar is that imported cases, which means that the cases that visited from the other geographical areas are much more than local transmission. So what does it mean? Can you please move to next slide? And what does it mean for the youths? Here we have the population pyramid of Myanmar, and then as you can see, there are a lot of youth population here in Myanmar. And interestingly, the rates of the infected people in Myanmar are more or less in the younger generation, as known as the working age group of between 18 and 45. So we talk about youth involvement in the COVID-19 prevention and treatment and things like that. However, we are sometimes forget about that these age group are the most high risk of getting COVID-19. Why? Because there are a lot of facts contributing to that. One is that in developing country like Myanmar, we cannot get the decent job here in Myanmar enough so that a lot of working generation need to travel outside to the neighboring countries to work and to earn. And when they come back, they got tested, and some of them got they found to be positive. So that's one reason. And another reason is that apparently they are the largest age group here in Myanmar, so they are higher risks of getting infected in this age group. And then another thing sometimes we forget is that when we talk about young generation, we should not forget the working young generation who has to go to work and earn, and they are usually the breadwinner of the family, especially in Myanmar setting. So they cannot stay home because of the family matters, and they have to go out, and they have the higher chance of getting infected from COVID-19. So that's why youths are important and as a working group for prevention and control, as well as they are important because of they are at the higher risk of getting infected. So that means that if COVID-19 hits on a country, the impact of COVID-19 in the youth of that country is it's the determinant of how the country will get over after COVID-19. So next slide, please. So as we said, youths or like younger generation are higher risk. Why? Because you can see like in this picture of the mass assembly was taken in March 11, which was taken in the university campus celebrating a youth activity, and they like to outgo and things like that. However, with the situations change, youth are the example of the good discipline and they obey the rules and regulations to prevent the COVID-19. So from here we can see that youth in other hand, has the higher risk of COVID-19 infection. However, if we nurture and if we sort of acknowledge and support technically well to the youth, they can be the good example to our citizens. So we have to make sure that we use the youth groups and youth projects in right approach and right sort of implementation manners in public health activities. Next slide, please. So, like I said, in country like Myanmar, the impact of COVID-19 on youths literally translates to the impact of COVID-19 to the country. There is ILO global report saying that the impact of pandemic on young people is systematic and deep and disproportionate. So it's really hard on young women and younger youth, and especially in lower income countries like in Myanmar. So I like to highlight that when we talk about COVID-19 impacts on youth, it is very systematic, meaning that multi-sectoral, educational, social, economic, health, and mental well-being. So when we implement the public health program and when we set public health programs at the system level or the policy level, we usually sort of like to verticalize the program, meaning that the health intervention is the prioritized. But however, in to minimize the impacts of COVID-19 on youths, we have to think across all the sectors, especially in the education, social, economic, health, and mental well-being. Next slide, please. So, and another alarming issue here in Myanmar is the mental well-being of the younger generation during COVID-19. We have some figures, but I like to sort of relate with other countries as well, that the age group of 15 to 29, the second main cause of death is suicide. So here in COVID-19 period, we are seeing a lot of mental problems and suicidal cases, especially in younger generations. So that's another alarming issue concerning with youths and COVID-19. Next slide, please. So as from the public health perspective and from the one of the youth ambassadors here in Myanmar, I would like to say that it's really encouraging and it's really pleasant to see the different youth activities. However, we need to strategize the youth activities and how to strategize and how to get along with the national level COVID-19 response. We have to make sure that each and every activity that intend to engage young people should include these three key objectives as guided by WHO. One is empowerment, which means that we empower the youths by letting the youths innovate their programs and projects. Like Ms. Rena present, there are a lot of innovative projects and youth-targeted projects. We need to find and empower them. And another thing is action. So as we all know, the volunteers and healthcare workers working for COVID-19, they are mostly younger generations, like under 30, under 35, and that kind of age group. So we have to make sure that they are engaged in every level of action against COVID-19, even in the community level and in the decision-making level and planning level. And another thing to consider is participation. So the key, like for example, the way of communication to the youths is different to the way of communication to the older age group. So it's really important to have their voices, especially in the community outreach programs, like for example, developing and designing the key messages. We have to involve and we have to get the youth's participation in that areas. So I like to again highlight that all the programs that we are intending to get the youth engagement, we have to make sure that they have these three key objectives of empowerment, action, and participation. Next slide, please. So even though the programs and projects that are designed to fight against the COVID-19 and to include the youth, we still have challenges. And not all the roads are very smooth. So I like to highlight here about the challenges that are specifically facing for the youth here in Myanmar. So resource limitation, like the speakers from Laos has mentioned, we have resource limitation, and we have the questionable sustainability of the initiatives. Like for example, youths have developed a software and applications and things like that, but how do we sustain it? How do we make it available in the community for like next 10 or 15 years? And we need to include youths inclusive policy and planning in COVID-19 action. That means that youths need to take part in the national level policy planning and decision-making level. And we still have competing interests. That's a typical case here in Myanmar because we are having election and we still have armed conflicts. So those areas we have to prioritize the needs. So, and another barrier that we are facing here when we are doing the youth inclusive activities is language barriers, because we have a lot of ethnic minorities here. And as you all know, and I think the first speaker has mentioned that there are some internet scarcity in rural area of Thailand as well. So we here face the same problem as well. So here, I'd like to sort of encompass the presentation that even though we as, the student leaders or youth leaders or NGO workers or, the community member as a farmer, we try to fight this battle against the COVID-19 and we try to involve the youths. However, we still need to systematize the youth activity and youth involvement at the national level and policy making level, because of those facts that I mentioned. Especially youths are the higher risk of getting infected, and youths actually are the main component of the population pyramid, and youths are the one who can lead the change and get the innovative ideas and get other community members along with this battle against the COVID-19. So I'd like to stop my presentation here. And the last message that I'd like to give is that to emphasize on the advocacy of youth involvement at the policy level, because we have to win this battle, and we can win this battle, but we can do this only with youth involvement. Thank you. Next slide, please.
Thank you very much. And thank you all speakers. Actually, all your work is very amazing. I salute the spirit, ability, and creativity of young generation. And when I heard from all of you, I think the types of activities are more or less the same. But the highlight of the activity is different from cultural, socio-economic, and political background of each country. For example, what I heard, like Bangladesh mentioned about refugee, the Philippines mentioned about ethnic groups, as well as Myanmar. And you also mentioned that youth is It's actually youth is not youth, but a working group as well. And Thailand mentioned about LGBT, which is different from other countries. And Vietnam touched on urban poor. So this is represent what happening in your country. But and come to the term of multi-sectoral collaboration, I see that all organizations work with government and NGO and academia and among youth themselves. But in reality, in the working environment, you may have heard a word, working in silo, meaning that people tend to work within their silo, their box, not work across sectors or interdisciplinary. For example, government tends not to coordinate with NGO, or if I work in a health area, I only focus on my area, but not coordinate with people working on agriculture and environment, something like that. And Myitzu mentioned that actually everything is interconnected. Like when you see youth, you have to relate them with education, health, economy, and housing. And what Mr. Dang mentioned that although his work is on organic agriculture, but it contributes to health, environment, education, and economy as well. So this is multi-sectoral collaboration. This is what I heard from all of you. But I would like to bring one challenge from that Myitzu mentioned that is about sustainability of initiative, as well as how to get youth involved. I would like to, my first question, I would like to throw this question to everyone, or speaker. How did you approach your partner, or your partner approach you? That's why you come up with the activity. I don't mind who will answer this question, but I just throw it to everyone. You have a great activities during COVID-19. Is it you as youth approach your partner and tell them this is what you want to do, or your partners approach you and tell you you should do this and that? Who would like to answer?
Can I?
Um,
Can I go?
yes, of course, Nabin, right?
Yes.
Okay, maybe start from Nabin, followed by Jane.
Okay, thank you. So the question was actually how did we approach, or did I or us approach, or did the externals approach us for the collaboration? Well, actually, it's a two-way process, I would say. In some kind of events, we had to approach the partners to collaborate with us, because there are some topics, like if I would like to say about the refugee rights, these topics are not generally talked about. So for these topics, we had to focus on the externals, and we had to approach them to talk on these topics. But in case of some topics which are really common, like in case of surgical protocols, yes. Can you hear me?
Can you repeat it again, please?
Which part? Which part? The whole thing?
Yes, please.
Oh, really sorry. Can you hear me properly now? Oh, okay. Thank you. So the first part I was talking about was there are actually two perspectives. We had to approach some of them, and some of them approached us, because if I talk about refugee rights, this is a unique topic that is not generally talked about. So in that case, we had to approach the external collaborators or partners. But in case of topics which are really common for medical students, like the surgical protocols or the healthcare facilities during the COVID-19 pandemic, in these cases the external collaborators were actually wanting to collaborate with us, because we are a large organization from our country. So in that case, there will be a bilateral communication, bilateral bonding, and bilateral sharing of interests, so which actually promotes these partnerships and these collaborations. So yeah, I think that answers your question. Thank you.
Thank you, Jen.
Okay, in Children and Youth Council of Thailand has the opportunity to work with a new network during the COVID-19 outbreak. This includes the Ministry of Public Health, the National Health Foundation, a network of youth network from regions, university in organization, debate competition, and also political party.
Right. So actually, is I think both way. Maybe you approach the partner, and sometimes partner approach youth first. Depends on the interest. Um, um, I would like to encourage audiences or participants. If you have any questions, feel free to text on the chat box, and then we will collect your questions and ask the speakers. Um, so, so what make your work well with partners? Okay, you already initiate partnership or bonding, but what make you work well with partners, especially in the time of pandemic? Uh, can I go to Myitzu if you have any idea? Then followed by Rena.
Thanks, Anand. Hello?
Please.
Yes. I think someone just have a comment or something like that. I heard. Does anyone has a comment before I answer the question?
No comment at the moment. Please go ahead.
Okay, thanks, Nano. That's a really great question. And I would say that first of all, why does it work to work with our partners, right? That's the question. So we have a common, how can I say, common battle to win. So we have the common thing to fight for, which is COVID-19. So that make us unite, and that gives the strength to fight this with all the measures that we have. That's the one thing. And another thing is that I would say that the recognition of the importance of collaboration across every sector. Like, for example, in our work, we work together with healthcare workers that works in different geographical location of Myanmar, as well as with the Ministry of Health and Sports and Ministry of Social Welfare and other government areas. So what we found interesting and encouraging is that all the different stakeholders have the common interest of protecting our community against this COVID-19 and to get resilience over that. So we are so encouraged to have a very positive working environment across all our stakeholders, and the technical support across the international platforms, like, for example, together with the Thai NHCO and together with other academic institutions and WHOs and other technical agencies. They are trying to provide the field level healthcare workers with their updated knowledge and useful tips and practical guidelines and things like that up to date. So that works well from my point of view. And third point is that the financial assistance from the government and other non-governmental organizations, like, for example, we we see that globally there are some emergency funds for this COVID-19, and that really empowers every actors of healthcare and other sectors to fight this COVID-19. So I would say that one is the common enemy to fight. And another thing is the multi-sectoral collaboration among the different stakeholders. And third is the financial and technical support from international community. Thank you.
Right. Thank you. Rena, would you like to add more from Myitzu?
Oh yeah. Hello. Well, for us, and I think I agree with Miss Myitzu that we have the mm, same battle to fight. But more than that, it's mostly our partners are really initiated also by our members. So some of our members are already part of these multi-sectoral collaborations, multi-sectoral initiatives. So as an organization, we amplify that. So that way, our communication channels are smooth already. So having everything based online now, it made our communication much easier. But sometimes internet instability is still unreliable. And at the same time, we acknowledge that these are people that behind these partnership, and that the pandemic has impacted each and every person in different ways. So as much as possible, we try to be transparent and we try to be understanding and considerate. Unlike me too, we don't take there's financial concerns isn't financial factors isn't really much part of the partnership, but either way, it still helped us gain and maintain these partnerships together and promote more projects and amplify them. Thank you.
Thank you. I got someone raised a hand, Mr. Sweet Nai. Can you, before speaking, can you introduce yourself, your organization, and country, please?
Okay, thank you for the floor. My name is Suvinai. I am the representative of International Federation for Medical Association Thailand, or AMSA Thailand. So I'm actually have the question to the speaker. What do you think is the greatest challenge in multi-sectoral cooperation during COVID-19 pandemic?
The question for all speakers. Who would like to answer first?
Can I go?
Yes, please. Go ahead.
Okay, thank you. So if I would say the greatest challenge that we faced in our country due to actually promote the multi-sectoral collaboration was actually to find appropriate partners. That was the main problem, because there are many organizations, many sectorial, many sectors, many people who are actually wanting to collaborate, but who are efficient enough and who are actually willing to dedicate their organization or dedicate their work for us and build a mutual relationship between us. That's the main thing that we could not find initially, but gradually this problem was solved, because people understood that multi-sectoral collaboration is important during this pandemic, and then we could actually find suitable collaborators, suitable partners to actually solve the issues, or at least work for the issue, towards the issues. So yeah, I guess that answers the question.
Anyone would like to add on from Nabin? Somehow the challenge, even though the speaker hasn't answered this directly, but as Ms. Su have mentioned, is a financial assistance, it could be challenge. Although Rena mentioned that money doesn't matter, but to some extent or to some country, financial support is also help to boost multi-sectoral collaboration somehow. And Rena mentioned about communication channel. It's not about channel, but the communication itself, that when you work in different sectors, in different fields, you have technical terms that when you're talking with other sector, they hardly understand what you're talking about, even though you speak in the same language. Communication is also the challenge. This is this is I got it from all the speaker. I tried to raise it up again. But actually, IFMSA Thailand has done quite a lot during COVID-19. So I would like, do you want to share the experience from your organization?
Okay, thank you. So during COVID-19 pandemic, IFMSA Thailand, as the representative of medical students from all 23 institutions in Thailand, we launched various projects that aim to address the COVID-19 problem. One of the projects we have here is face shield for our fighter. This one is also an interdisciplinary cooperation between medical students, of course, by IFMSA Thailand, and also the Dentistry Student Association and Nurse Student Association. So in this project, we are gathering a student volunteer from all 3 faculty to produce a face shield and distribute it to the hospital and healthcare facility in need, because after all, it is not only doctor as the only profession that need this protective equipment from their work, from occupational risk for COVID-19. The dentist, the nurse, the technician, they also are at risk. And by cooperating, by coordinating together, we are able to produce more face shield than, of course, than we are doing alone by our one organization. That is one of the examples that I like to add. But to add more to my question about the challenges, one thing I want to share is that I personally am a director of a project called Cross UAR Open Your Heart. It is a project aiming at creating a COVID-19 educational media in sign language. So basically, I like to echo what Kun Ranut has said, that technical term is very important, because basically we have to translate medical term into a sign language, and there are many words, many expressions that do not exist in sign language, or perhaps some concepts that do not exist in medical term, that we need to spend some time to make sure that everybody is on the same page. We are all understanding this, that something that important message about COVID-19, about the self-protection and so on, will not be lost in translation. We spent some time, yes, but in my opinion, it is a time well spent, because despite it being a challenge, in a way, it can be an opportunity to learn, both from the side of the sign language interpreter and the side of the medical student who are creating a content for that. So I think I like to see this two ways. It is both a challenge and an opportunity.
Correct. Thank you. It's correct. It's both challenge and opportunity is almost the same coin, but just another side. But I would like to encourage the participants from various countries to share your view, or you ask the questions. That would be great. So we would like to engage all of you on this webinar.
Can I sort of like add to that challenges question, please? Hello.
Go ahead.
Yeah. So thanks for sharing what IFMSA is doing, and it's really interesting, and it's sort of like including the vulnerable population. So it's really impressive, and I'd like to sort of like add one point about the biggest challenge that we see at the policy level and system level here, and I think that can apply to other countries, is the competing interest. Like, for example, this is the global pandemic, so it has a lot of economic, political, and social impacts. So politicians have, like their political interests, and the healthcare workers have their technical interest in that. So for multi-sectoral collaboration, it's really important to have a common ground and common collaboration, understanding and consensus of what we expect to get for our community at his best. So it's not to our best interest, but for the community's best interest. We have to get that mutual consensus between the important decision makers and stakeholders. That's the biggest challenge, and that's the very difficult thing to sort of like get consensus. Thank you.
Thank you very much. Very good point, and is in reality, completing conflict is is true. Is true, especially right now. It's about public health and economy during COVID-19 pandemic. And as Nabin said, it's not at the beginning. It's not easy to find a mutual benefit. It takes time. Really, a very good point. I got a question from Hanoi. I guess it's from Vietnam. Would you like to ask the question by yourself, or should I ask the question? Okay, let me ask the question from Han. I'm sorry that I cannot. From FIDR Vietnam. In case of remote areas where availability of internet is not popular, as well as lack of accessibility in modern technique, do you have some successful case stories for youth involvement? This question for all. Uh,
Hi. Hi.
yes.
Yeah, there. I think I can answer the question. So my okay. So I guess this isn't really much of a successful case story, but more of a plan. Because in the Philippines, there's a lot of we're in a very um, the we're in a very geographic. Well, we're very geographical. We're in an archipelago, so most of the disadvantaged areas, the rural areas, doesn't really have much internet. So our organization's plan to reach. So uh, there's a group of people that's indigenous people of the Philippines um, that are disadvantaged even before COVID-19. So they already have organizations that are able to reach that part of the rural areas even without the internet. Our plan as an organization is to partner with them to be able to reach them and inform them of the situation and give relief goods and other services that we can provide to those kind of people. Yeah. So it's more on partnership of um, the goal is for us to partner with those people who can reach them and not merely being on the internet. Yeah, that's all.
Right. Thank you. Next, Jen will share her view.
Okay. In Thailand, we have a organization with Children and Youth Council of Thailand. Member of Children and Youth Council of Thailand have overall, we have a member on sub-district. Yes, when we have a member on sub-district, we can advocate knowledge and how to protect yourself, how to protect everyone in your country. So we go to in country and use connection and give something, give knowledge, give information, give something to yes, necessary, yes, for everyone in country. Thank you.
Thank you very much. I think internet is not only tool in the to communicate with people. Although we are in a digital technology world at the moment, but I think for, the experience from Philippines, from Thailand, and I'm sure from Myanmar as well. You work with in a remote area. You find a focal point, and then you work with the focal point, reach out them, and then let the focal point or coordinator work with their community in a remote area. So that can help instead of using internet. But I got a message from Sahir Abbas. This person would like to share a case study. We would like to hear from you. Can you introduce yourself, your organization, and your country? Brief, please. Sahir? You still unmute, please, Sahir.
Are you listening to me?
Go ahead, please, Sahir.
Okay. Thank you so much. My name is Sahir Abbas, and I am from Pakistan and belongs to Research Advocacy and Social Training Institute, RASTI. So I want to share two case studies. One is the recruitment of Tiger Force. As Ms. Myitzu shared in his presentation that youth ratio is very high in Myanmar. Same as in Pakistan, our current population, about 65% of our current population is from 15 years to 35 and 38 years. So we have a large number of young peoples in the history of Pakistan, and as you all know that Pakistan is the world's sixth largest nation in number. So it was very difficult to involve the young peoples in positive activities and how they can contribute in COVID-19. So one of the biggest initiative of our government is to establish announce a Tiger Force. Through this announcement, a number of young peoples from all over the Pakistan registered themselves, and through this Tiger Force, these young peoples registered 120 million needy persons and 80 million individuals who get a relief from the government, 12,000 Pak rupees every month. So this was one of the biggest involvement and participation of young peoples to register these peoples and to help the local authorities and local governments. So as you know that the net access and the latest technology is not accessible in all over the Pakistan, because 75% of Pakistan is in rural areas. So other ways are searched by the government, like they announced in the mosques through local administration in each village, and they send messages through in each through local government. So one of the one case study is this, that like this way they involve my young peoples. And second, like I want to share the case study of our organization, that during this pandemic in two districts we established 1200 child friendly spaces. So these child friendly spaces management was the responsibility of young peoples who don't have access to mean all not have access to internet, but we train them to keeping in view the SOPs, and even still schools are closed in Pakistan. And this initiative was very encouraged by the government, and this model is adopting other organizations. So these are the two case studies I want to share, that in which are a huge number of young people participated actively. Even this participation is opposed by the opposition parties in Pakistan, that maybe this tiger force will used for political purposes in future. But I think this was a great initiative by the government.
Thank you very
Thank
much,
you.
Sahir. Thank you for your cases, and that also answered the earlier question.
Thank you.
I think we almost run out of time. So the next sessions, we have Dr. Veerasak Puttasi, Deputy Secretary General of National Health Commission Office, Thailand. He has attended the webinar since the beginning, and I really want to know what the adults think. Let's hear his reflection from our discussion.
Thank you. First of all, I would like to thank all speakers, of course, including the Pakistan case study and participants' reflection as well. You will contribute more information and know-how about to tackle the COVID crisis very well. These are my witness of the power of the new generation or the young generations and the skill for the 21st century and the VUCA world, that the world is changing rapidly. I see that the young generation has a higher level of digital literacy than, of course, than the older generation or their parents. So the channel of the communication is borderless. I see this advantage, and borderless and worldwide. That means you quite know well how to go to find information and ability to check whether or not it's the fact or the fake information. Therefore, in terms of the connect to others, I think you know how to raise the social awareness using social media and platform. From the Bangladesh study, Bangladesh Medical Student Society demonstrate us how to use the online campaigns and a webinar for the medical students, in particular, to know their role and tackle in the such conditions, and how to advocate the people in the settings. I learned from the Philippines, ASEAN Medical Student Association in Philippines. They also use online campaign as well and makes more clearer of the national policy, quarantine policy, something like that. During that time, with the information, there are high demand for the informations that then increase of the misinformation as well. The social media, therefore, is used effectively, consequently, very appreciate. For the Thai CYC, I also use the online activities model to include the self protection programs and report the situations during the outbreak. You aim to raise awareness and understanding of the self-protection of the communities. This is the witness of to use high technology and internet for the COVID. The second one I would like to explain is the young generation is you can collaborate amazingly well and really high caliber of the multitasking ability as well. I also found that the young generations demand to show that your creativity. I am appreciate of the some of you of the younger generations. They care about the want to do something, make a difference, want to make something change with the high and inspiration to change the society. I have learned from the CPI that you share your experience of the engagement of the with the conflict solutions using support the dialogue, understanding the collaborations, cooperation between the national level and with the ethnic group or the community-based organizations. In the Philippines as well, they show that show your power to move to society is not limit to the disease oriented, but you use the multi-sectoral implications in the pandemic. Yes, you include the human rights, you put the gender-based violence, something like that. This is a social determinant of health. The third one that I want to put that why we need more channels and the platform to involve for the younger generation to increasing involved on the policy and implementation for the new era challenge. The CPI emphasized that an existing good relationship between partners, reliable of the information accessibility, staff capacity of the technology uses. This is crucial to respond to COVID. And I learned from the CPI. From Myitzu as well. Myitzu was, I really love your keyword. You gave us the empowerment. You gave us the action and participation. This is the general of the approach for the social engagement. In the Philippines, again, you echo the success factor to implement must include the proper of the communication channels, transparency and understanding and considerate. These are as well as the wild farm of the Vietnam and Mekong refugees. You also said over about the issue of the transparency and influence the people. The wild farm also you focus on the food security first for the local people, especially for the poor resident in the urban community. Not only that, but you start working together from the different actors and better achievement and support your work for the successfulness. I would like to end my remarks with the appreciate the power of and your contribution of the young generations. This meeting is remind me to recognize the Viking law of the Scandinavian history of the proverb. They say about the good Viking should be prepared. Be prepared is mean keeping weapons in good condition, finding a good battle comrade, agreeing and start working with the common agreement and interest. Hopefully this meeting, I think this will be the place that we made the good comrades and sharing our know-how and wisdom for the good response for any further crisis and challenges. Thank you.
Thank you very much, Dr. Virasak. You capture and echo the voices from all speakers that is very touching and very very creative. Thank you very much indeed. Because since right now it's almost 5 o'clock, I think we run out of time. Once again, I would like to thank all speakers and audiences for sharing your views and experiences. You can give us a feedback on Google evaluation form. We will send it to you on the chat box and on email. And the webinar report will come out early September. So please follow up on our website. Thank you very much for this collaboration, and I hope that we will be able to see you face to face again one day, and we will have another webinar soon, and I will inform you again. Thank you very much. Bye. And I will collect all messages on the chat box and put it on the report too. Thank you. Bye.
Thank you guys for actually inviting all of us, or actually inviting us for this webinar, and it was nice to actually interact with all of you guys, and hope to have such collaborations, have some important webinars in the near future as well. Thank you.
Right. By the way, I seen Kyoko from Japan raise her hand. Would you like to say something, Kyoko, from ASEAN Health Institute?
No. Yeah, just appreciation.
You have to say now.
Yeah, just appreciation. I don't have any opinion, but thank you so much for this very interesting meeting, and I enjoyed your very active participation. Not only the speakers, but also the listeners. Very active discussion you exchange. So I also enjoyed very much. Thank you so much.
Thank you, everyone.